I was in Nepal this April when the earthquake hit, and I cowered under this table. The apartment building was rattling like a freight train, and I kept thinking, I'm a doctor. Shouldn't I be doing something? But then the shaking would start again. I could hear screams outside, and I just hung onto those table legs and hoped that 4 stories wouldn't collapse around me. When I did feel comfortable enough to go outside, I could see the temples closest to my apartment had crumbled to dust, and the army was looking for survivors. I felt compelled to go to the Patan Academy in the Kathmandu Valley, where I'd been working with local faculty on their family medicine program. And when I arrived, all of the medical students and staff had enacted their emergency plan. They were running these busy triage areas, rushing the most injured into surgery. Historically, Nepal has an earthquake very regularly, so they were prepared. And I watched, because I don't have surgical skills and I don't speak the language, so I really wasn't needed. I went back to my apartment feeling puzzled. My internet was working, so people from back home were asking, what are you doing to help save people? And telling me I would be such a hero. And sometimes I was honest, saying I wasn't feeling particularly useful. And they would say, well, why don't you distribute some food or dig people out of the rubble? But I don't have rescue skills. And I felt powerless and irrelevant. And this is not something I'm used to. Since that time, I've wondered, why did everyone, including myself, have this expectation that I would be able to do something? And it's hard for me to reconcile that, although I am a doctor and I run a nonprofit, I really hadn't been able to help very much at the time. I just felt so traumatized at witnessing and leaving so much devastation. And these last couple of months, I've continued to feel traumatized, not just from having survived an earthquake, but knowing the ongoing challenges left in Nepal, and also this realization that the skills I've developed for over 20 years don't always have value. And through conversations with mentors, I've shifted my perspective. What I've come to believe is that this way of thinking is built into the system, that people with so-called expertise would always be more useful than others. It's a part of what I learned when I studied medicine and medical education. When I think about medicine, it's actually easy to see how all of the expertise we gain can lead to arrogant behaviors. As a family doctor, I teach students to ask patients their feelings, ideas, fears, and expectations. This is what we call the patient-centered method, and it's ultimately trying to find out the context of how a disease would affect a person's life. But in practice, this doesn't always translate. We know 30 to 50% of prescriptions go unused, and doctors call the patients non-compliant, which is a pretty loaded word when what we could be saying is that we fail to suggest something that would work for them. But should this come as a surprise? There's research that shows doctors cut a patient off only 18 seconds into the interview. It takes longer to order a coffee. But as doctors, we hear a few words and think, oh yeah, I know that story. My first week back at work, there were concrete examples of times where I don't question the assumptions that come with my expertise. When I asked this lovely lady if she would want to be resuscitated, I presumed the answer would be no, because of her age and her severe heart condition. But that was before I knew that she still teaches piano to 22 students, and she's still deeply in love. My false assumptions led me to forget that every situation is unique. These same assumptions often mean doctors don't always listen to other caregivers. When this patient's nurse paged me to say she had a football-sized lump in her leg, I thought, well, she's probably exaggerating. I just saw this patient an hour ago. But nurses are at the bedside, and they often know more than us when it's happening. This issue with expertise, that we always think the so-called experts know best, It's pervasive within individual relationships like that between a doctor and a patient. But it's the same, if not worse, at an institutional level. Just think back to the news that you watched about Nepal. Think about how many organizations rushed in to help without asking the locals what they need. I saw one hand out soap and toothbrushes to people who hadn't seen water for 4 days. And what about the global health aid? Of course, there's a lot of great work being done, but it's actually easy to find so many illustrations of this exact issue. When Cambodia was looking for support of its health system, they requested about 40% primary care and about 10% HIV. What they got was almost exactly the opposite. HIV gets a lot of attention, about 60% of major donor funding. But in terms of years of productive life lost, there are other big illnesses like diarrhea or illnesses related to maternal and child health. Chronic disease like diabetes and hypertension accounts for 7 times more productive life lost compared to HIV. But you just don't see people making posters for stomach flu or blood pressure. My friend Innocent tells me how in Uganda, funding for tuberculosis is running out, and patients are trying to contract HIV in order to get their TB treated. Situations like this arise because experts get arrogant and they don't feel they have to listen. When I do hear about locally driven initiatives, I really learn something. There's a great example at the Patan Academy in Nepal, where they offer scholarships to high-achieving rural students, and they train them in remote villages. So these new doctors feel confident and comfortable working where they're needed most when they graduate. There are countless stories like this that we aren't always hearing because we aren't always listening. But imagine if we used the world's collective knowledge better, how much more we could all achieve. So if this problem is built into the system at so many levels that people with perceived power and expertise don't always listen, what can we do about it? I believe that those of us with expertise need to begin by making change in ourselves. So I'm going on a journey from hero to humility. It's early days and a lifelong process, and the more expertise I gain, the easier it is to forget that I don't know all the answers. I invite you to join me on this very bumpy path. Let's transform our thinking. Let's change our organizations and institutions. Let's do the truly heroic thing and get humble.